Have you ever wondered what gallstones are and how they affect your health? So, let's unravel this medical mystery together. Picture this: your gallbladder, a small, pear-shaped organ nestled right under your liver. Its role is crucial. It stores bile, a digestive fluid produced by the liver that aids in breaking down fats. Now imagine this bile hardening into tiny particles like pebbles on a beach. These are gallstones. They can be as small as a grain of sand or as large as a golf ball. Some people might only have one gallstone, while others might have several. Gallstones primarily come in two types: cholesterol stones and pigment stones. Cholesterol stones are the most common, making up about 80% of all gallstones. Despite their name, they're not caused by cholesterol in your diet. Rather, they form when your bile contains too much cholesterol and not enough bile salts. On the other hand, pigment stones, which are darker and smaller, form when there's an excess of bilirubin in your bile. Bilirubin is a waste product that your body creates when it breaks down red blood cells. Conditions that increase red blood cell destruction, like certain liver diseases and blood disorders, can lead to pigment stones. The fascinating thing about gallstones is that they can live quietly in your gallbladder without causing a fuss. This is often referred to as silent gallstones. However, if a gallstone blocks the bile ducts, that's when things get complicated and painful. Understanding gallstones is like putting together pieces of a puzzle. It's a complex interplay of your body's chemistry, your gallbladder's function, and even your genetics. But don't worry, you're not alone in this. Millions of people worldwide have gallstones, many of whom aren't even aware of their tiny, unwelcome lodgers. Now that we know what gallstones are, let's delve into how they make their presence felt. So fasten your seatbelts as we journey further into the mysterious world of gallstones. Gallstones can be silent invaders, but when they decide to speak up, they can cause a stir. The symptoms of gallstones are as varied as the individuals they affect. Some people might not even realize they have gallstones until a routine checkup reveals their hidden existence. But for others, gallstones can signal their presence with a range of uncomfortable symptoms, from mild discomfort to severe pain. One of the most common symptoms is a steady, gnawing pain in the upper right abdomen. This pain often intensifies over time and can even radiate to the back or beneath the right shoulder blade. It's typically triggered by high-fat or high-cholesterol meals, which stimulate the gallbladder to squeeze harder and increase the pressure on any existing gallstones. Now, if a gallstone blocks the bile ducts, it can lead to inflammation and infection of the gallbladder, a condition known as cholecystitis. This can cause symptoms like fever, chills, and an intense, sharp pain in the upper abdomen. Jaundice, a yellowing of the skin and eyes, is another sign that gallstones might be causing trouble. This happens when a gallstone blocks the bile duct leading to the liver, preventing the liver from removing bilirubin, a yellow pigment, from the blood. Nausea and vomiting are also common symptoms, especially if the gallstones are causing inflammation or infection. You might also experience changes in bowel movement and urine color. Stools can become lighter colored, and urine might turn darker. Bloating, indigestion, and gas can also signal the presence of gallstones. These symptoms often occur because gallstones interfere with the gallbladder's ability to release bile, which helps break down fats in the food you eat. In some severe cases, gallstones can lead to pancreatitis, an inflammation of the pancreas. This can cause symptoms like severe abdominal pain, rapid pulse, and fever. Remember, gallstones are sneaky. They can remain silent for years, causing no symptoms at all. But when they do decide to make their presence known, they don't hold back. Experiencing these symptoms, it might be time to seek medical advice. Gallstones don't always come quietly. Sometimes they send out warning signs. Let's delve into the realm of gallstones and the signals they send to alert us of their presence. When gallstones decide to make their presence known, they aren't subtle. One of the most telling signs is a sudden and rapidly intensifying pain in the upper right portion of your abdomen. This is not your everyday stomachache, but a distinct discomfort that can be hard to ignore. But the pain doesn't always localize to one area. It can also manifest at the center of your abdomen. Imagine a band tightening around your midsection, the pressure building up over time. That's what this gallstone-induced pain can feel like. It's not a pleasant sensation and certainly not one that should be brushed off. Now you might be wondering, why the upper right or central part of the abdomen? That's where your gallbladder sits, tucked under the liver. When gallstones block the bile ducts, it causes intense pain as your gallbladder contracts to try to push the bile out. This contraction against the blocked ducts results in what is commonly known as a gallbladder attack. But gallstones don't stop there. They can also cause your skin and the whites of your eyes to turn yellow, a condition known as jaundice. This happens when gallstones block the common bile duct, causing bilirubin, a yellow pigment produced by the liver, to build up in the blood and deposit in the skin. Another warning sign to look out for is a high fever or chills. This could indicate an infection in the gallbladder, liver, or bile ducts due to gallstones. In the end, gallstones may not always be silent. They often sound the alarm through discomfort and changes in your body that are hard to ignore. It's important not to disregard these signals. Remember, recognizing these warning signs can be crucial in managing gallstones. But what happens when gallstones sneak in undetected? Now that's a question that could keep you up at night. Imagine an invisible threat lurking in your body, undeterred, undetected. It might sound like the plot of a sci-fi movie, but this is the reality for many people with gallstones. Often, gallstones do not announce their presence with an array of symptoms. Instead, they quietly take up residence in your gallbladder, causing no discomfort or pain. You could be leading your life blissfully unaware of these tiny intruders. This is what makes gallstones an invisible threat. But why is this a concern, you might ask? After all, no pain, no problem, right? Well, not quite. The lack of symptoms doesn't mean that gallstones are harmless. Far from it. When gallstones go unnoticed, they can lead to complications over time. One of these is gallbladder inflammation, a condition called cholecystitis. This occurs when a gallstone blocks the cystic duct, the tube through which bile flows from the gallbladder to the small intestine. When the bile can't exit, it builds up, causing the gallbladder to become inflamed. This can lead to severe abdominal pain, fever, and even jaundice. Another potential risk of undetected gallstones is infection. If a gallstone blocks the bile ducts for a long period, bacteria can build up and cause an infection. This could lead to pus-filled gallbladder, a severe condition known as empyema. If not treated promptly, it can be life-threatening. So you see, gallstones, whether silent or not, can pose a real threat to your health. They can lie dormant for years, only to cause serious complications when least expected. This is why regular checkups and a healthy lifestyle are key in preventing these silent threats. Remember, just because you can't see or feel something, doesn't mean it's not there. Even the smallest of stones can cause a ripple effect of complications in your body. Silent or not, gallstones are a health concern that deserves our attention. So, gallstones, a tiny entity causing big trouble. Sometimes, it's the smallest things that can cause the biggest problems. In our gallstone saga, we've delved deep into the mysterious world of these small, pebble-like deposits that can wreak havoc in our gallbladder. They may be as small as a grain of sand or as large as a golf ball, but their impact on our health can be substantial. We've uncovered the common symptoms of gallstones, like the infamous gallbladder attack that can strike with a sudden and rapidly intensifying pain in the upper right or center abdomen. We've learned about other indicators too, such as back pain between the shoulder blades, pain in the right shoulder, and nausea or vomiting. These symptoms might not always be present, but when they show up, they demand attention. We've also discussed the warning signs when gallstones sound the alarm. Extreme symptoms like jaundice or a high fever with chills signal that immediate medical attention is necessary. Gallstones are not to be taken lightly, and these extreme symptoms are a clear call to action. But remember, the invisible threat of gallstones is that they often fly under the radar. Many people with gallstones won't even know they have them until a gallstone lodges in a duct and causes a blockage. That's when the real trouble begins. So what can we take away from this saga? That it's crucial to stay informed and aware of our bodies. If you suspect that you might have gallstones, don't ignore these signs. Seek professional medical advice. Don't wait for the situation to escalate. Early detection and treatment can make a world of difference. And remember, knowledge is power. The more we understand about our bodies and the conditions that can affect them, the better equipped we are to maintain our health and well-being. Stay informed, stay healthy. Don't forget to like this video and subscribe to our channel for more health insights.